the nation coming together and wearing masks and social distancing. It was a time to call out the importance of contact tracing, something that has been very challenging around the country for health departments to do. It was a time to call out the severity of this pandemic, the fact that 200,000
Doctor, let me get your name.
Lives, disproportionately people of color, lower income people in America. It was a time for pulling us together as a nation, not to talk about this as something that you don't need to worry about. I'm extremely worried about this pandemic, as are most public health leaders, because of the fact we're not doing the things that could really get this under control.
Well, his words didn't make us safer. Let's talk about his actions. His own doctor, Dr. Connolly, said the president is not yet out of the woods. He won't be for a week. In that time, what is the danger to President Trump and the people around him?
Yeah, when you look at the time course of a COVID infection, this is still in the heart of that period where you can get worse. And so it's really important during that time that you limit your activities, that you definitely limit your exposure to other people, because you are potentially infectious. It's a risk not just to yourself, but to those around you. And what you'd like to see is behavior being modeled that everyone in the country who may come down with this infection could follow. You know, we've talked about this before.
You're
safely at home, away from others. The fact
Proud Boys?
So many orders.
You can say it. Are you against the mob?
You'd like to see the behavior being followed that models what you want to see in the ideal situation, where people are not in contact with others when they're potentially infectious.
All right, I want to ask you about something that I think was the most important.
Ask the hard-hitting question. We trace, what do they call it? Tracing, whatever. Can we trace the blacks when they mobbed up? Can we trace them? What do they call it? Can we do that?
This to us, I mean, safety is the number-one issue here.
Well, you know, it's not just safety, it's trust. And in order to have trust that a vaccine that gets approved is safe and effective, we need to have hands off of the FDA. They need to be able to set the standards, and these standards make sense in terms of making sure you're following people long enough to see if there's safety issues, that you're following people long enough to make sure that there have been enough severe cases of COVID that you can tell whether the vaccine truly works. The idea that the political layer of government would tell FDA how to do their work is absolutely chilling.
The president tweeted this morning comparing COVID to the flu, saying we have to learn to live with COVID the same way we do with the flu. President Trump said when the weather got warm in the summer, it would be gone. He said we wouldn't face a second wave in the fall. We obviously are. He's got it. What do you think about his message? COVID and the flu, same diffy.
Well, I think that there are things people can do right now going into this winter to reduce their risk. One is to think about the flu and make sure you've got your flu shot. The other is to...
The first time, this is the first doctor clip that I didn't see was political. He answered the questions as a doctor should. Blessing for Bessier. What's your name? What's your name?
COVID and the flu are treated in similar ways, in that hopefully there'll be a vaccine and we'll be able to vaccinate. But at this time, the vaccine equivalent for COVID is social distancing, wearing masks, hand washing, and doing all of these things that have been effective in states here in the country, red and blue states that have employed them, and in countries around the globe that are taking this seriously and following public health.
Dr. Besser, always good to have you here. You always make us feel smarter and definitely safer. Coming up next, exactly 4 weeks away from election day.
Pretty much was not political. At the end, could get into it because he didn't go into it. Now, I got a question for you, Dr. Basir or whatever. So, of course, when Trump's fever broke, right? And, well, anyway, is he going to be fine without wearing a mask? in the terms of he's been infected, making the antibodies, he's not contagious. Him and other people that are infected with it, can they no longer worry about masks? Are they free? And before you jump on the bandwagon, well, 6 months their antibody kind of goes away and they can be susceptible to it. Look at 7 million people that's been infected with it. Wouldn't our numbers be jumping off the roof if all 7 million of them were still infectious, right? Obviously, people are not getting reinfected. So I'd love to ask you some questions.